Welcome everyone, this is Dr. Mercola, and today I'm joined with Gaea Powell, who has a really passionate interest in breast cancer and breast cancer screening, largely related to the fact that her mother died in 1991 from breast cancer. And of course it's a really common cause of death for women. It's the most common cause of cancer death in women, at least in the United States. So there is a large industry that has evolved out of this. And no one certainly likes to lose a relative, enjoys losing a relative from this, or them dying from this themselves. So there's a big effort towards prevention and screening to detect these these cancers at an earlier stage. And the traditional case, of course, has been mammography. But you recognized early on that this is perhaps not the best approach, and in fact it may cause more harm than good in the vast majority of women who choose to elect to use this type of preventive screening. So fortunately there are some alternatives, and you became actively involved with that, and are now a board certified thermographer and are passionate about educating women about their alternatives. Mm-hmm. So I'm wondering if you can tell me in our audience and describe your journey in the process you went through after your mother's death, and what compelled you to pursue this field, and some of the reasoning behind that.
Sure. As you mentioned, my mom passed away in 1991, and she was my best friend, and so I saw the very challenging journey that she had to take, and I learned a lot. And when she was getting to the end of her journey, we did get more involved in educating ourselves about preventative options. So for me, once my mom passed away, my doctor was trying to basically scare me and let me know I was at a high risk and I needed to have mammograms early. I basically was determined to help myself prevent breast cancer in the first place. I felt like that was the way to go, to try to head it off at the pass, so to speak. So when I was in my early 30s, when my mother passed away, and as I said, they were letting me know I was at a high risk, and they were trying to urge that I have mammograms at a very early age. And I did a lot of research at that time, so this is a long time ago, almost 20 years ago. And basically what I realized is that a mammogram would just let me know I already had cancer. And then I was also concerned about the repeated radiation year after year, and then the compression, because I was really concerned that if I did have a tumor, I wouldn't, it just really bothered me to think that it might be compressed and disturbed, or possibly spread. So that just wasn't a choice, a good option for me. So luckily in 1995 I discovered thermography. And thermography is a physiological test, so it allows you to look for physiological changes at an early stage. So as we know, when you go to the doctor's office, the first thing they want you to do is be weighed, have your blood pressure taken, and have your temperature taken. Those are physiological tests that can be monitored for stability over the time. So it's the same type of process. So every single person has their own unique thermovascular roadmap, and thermography allows us to watch that roadmap over time. So that just was a much better path for me, and I wanted to be able to be empowered and be alerted to physiological changes so I could try to make changes so I could help myself prevent disease in the first place. And so as I continued down that path, I was living in Los Angeles, and I honestly thought everyone was getting their thermogram every year. I didn't talk to my friends much about it at that time. I don't think women talk a lot about, like, hey, I went and had my mammogram today. What was your experience? So I didn't really know that much about mammography. Well, as my life continued.
Well, and how did you come to this conclusion? I mean, because as you mentioned, not all women are doing this, and so what information did you encounter in your journey that allowed you to uncover this safer and more effective screening option?
Well, the internet was just starting to, be utilized. So I was very fortunate, and I found a doctor via the internet who provided thermography. So, when I would have my annual imaging, he would go over it with me and let me know if there's any changes. He would suggest dietary changes or stress management. That's always the biggest hurdle in trying to reduce inflammation, because we know inflammation can lead to disease. So I guess I thought that everyone had the world at their fingertips like we do, and I thought other women knew more about thermography than they actually did. And like I said, I didn't really know that much about mammography, so I wasn't anti-mammography. I was just continuing down my life path and trying to stay healthy. And my thermogram yearly would remind me, give me that little, don't forget, take good care of yourself because things can change and you don't want, something more serious down the road. So when I left the Los Angeles area, my father actually became ill, and I went to take care of him up in the San Luis Obispo, that's the center of California. And I went to look for a place to get my thermogram, and there was no place to get one. So I was shocked. I'm like, well, that's strange. So after doing more research, because it's been so empowering to me over these years, that was really concerning to me.
So you've been doing this since '95?
I've been doing thermography as a patient since 1995, and then I became a board-certified thermographer about 4 years ago. And the reason why is because I couldn't believe it, but most women had never even heard of the technology. So it was like an epiphany in my life. I changed careers, I got trained, I've done so much research on it.
What were you doing previously?
I was working for Arnold Schwarzenegger as his chief of staff before he became elected governor, and before that I worked in the motion picture and film industry, and working in the business strategy, corporate end of it, to actually being on the set. So it was a wonderful career. It was very interesting, but this was so much more important in the big picture of things. So that's what really inspired me to get involved. And so I was trained. I started imaging in the San Luis Obispo area. And like I said, I wasn't anti-mammography or pro anything else. I just wanted women to be informed that they had another option to them, and that it's available to women of all ages, and it's not restricted by breast density or implants or reconstruction. And so what happened is I started imaging women, and they started sharing these incredibly disturbing stories about their experiences with the more traditional option. And so, which is mammography. And so I did a lot more research about mammography, because I'm like, how can this be? I mean, how do women not know there's a physiological test? And why is mammography our only option? And in actuality, if you do a lot of research about mammography and its strengths and its weaknesses, you'll realize that it actually should not be a standalone technology. And in fact, unless something's 100% accurate, it shouldn't be a standalone technology, in my opinion. So with thermography, MRI, and ultrasound, all of those imaging options need further evaluation. And if they can all be utilized in conjunction, as an adjunct to each other, that's probably the best way to go, from my research. So as I've continued down this path, I then started taking my case studies of thermograms of women who were alerted to problems at an early stage, so they could then be empowered with that information, take it back to their healthcare provider that they can partner with and help them lower their risk. So if their thermogram is indicating a high risk, it gives them an opportunity to do something about it, because the culture that we've created is basically cross your fingers and hope your mammogram doesn't tell you you already have cancer. And to me, that's insane. It's like, so when I understand too that a woman is told as she leaves the radiologist's office or she gets her report, if it says that you're negative, a lot of women think that that means they don't have cancer. Well, that's a very dangerous misconception, and it's misinformation in my opinion, because that doesn't mean you don't have cancer. That means that the cancer, if you do have it, just hasn't grown large enough for the mammogram, the X-ray technology, to actually bounce off that dense object. So, and again, we know that the weaknesses of mammography is that it may be effective for imaging through fatty breasts that are actually found, usually as a woman gets older, her, breast tissue starts to deteriorate, so it's more effective for imaging through the fatty breasts. But a dense breast is very challenging for a mammogram to read through. So it's really crucial that women know their density information.
And what type of women typically have denser breasts?
Younger women.
More
right.
fit women,
Exactly.
Healthier women.
That's what I was going to say. I think with women who are engaged in their health in general, because our breasts are not these separate entities. It's all about whole health. So if you can maintain your health throughout your life, your breast would stay obviously denser longer. I think that just logic dictates. So if the majority, or 40 to 50% of women have dense breasts, they really need to know that they should be utilizing an adjunctive imaging option. So with me, it just makes sense that I think all women should start with a thermogram first, a physiological test first, which you can utilize in your 20s. And if you're at a low risk, maybe have a thermogram every third year or so. But if you have family history, or you're already having fibrous cysts or sore breasts, or the different symptoms that are found when there's a hormonal imbalance, that you would come in more often. But just getting, my whole goal in doing this is to get women to engage early. Like, don't have a wait and see attitude. Inflammation leads to disease. So why wouldn't we want to know about that inflammation, years and years before structural changes occur? So most of the time with mammogram or ultrasound or MRI, that cancer has been growing there for many, many years.
Well, before we go further, let's just, you made some important, truthful points, but I think many people viewing this may not understand the connection between the inflammation and the testing process. So I want to expand on that, but before I do, I want to make a comment on the whole preventive strategy. Because I've always been interested in prevention, went to medical school to apply that, and then pretty quickly realized that the basis of most preventive strategies in traditional medicine is vaccinations, which is pretty much the foundation of it, and then these preventive screenings like mammography and PSA tests, which have, even the conventional task forces, preventive task forces, have come out against in most women that are under 50, and really recommending against the use of PSA at all for prostate cancer. But with respect to this inflammation connection, which I think is really crucial in mammography, mammography is ionizing radiation. There is just no question, it's non-controversial, it increases your risk of cancer. The question is, how much does it increase it? But the traditional mammogram, I believe, is equal to about 100 chest x-rays, and perhaps more if they do multiples or they do a compression screening. So, it's a massive exposure, which, we know it can't help but increase your risk. It's not going to make it the same, and it's certainly not going to decrease, it's going to increase it. So, this physiological alternative that you're referencing, which is an interesting way of referencing it, I hadn't heard that approach before, but it makes a lot of sense, just like taking your oral temperature. You're looking for signs of temperature change. And with mammography, you have ionizing radiation. But with thermography, there is no radiation, but you are measuring a form of heat radiation that you are making, that the instrument's not making, that you are making. And the sensor is detecting your radiation. And the reason why it's so effective is because it detects it at a far earlier stage, because typically it detects it when it's not seen by mammography, when it's in this inflammatory condition. And part of the process of inflammation is increase in temperature, which is what this device detects. So I think that connection between inflammation and thermography, I think many people may have not understood. So I just wanted to insert that, and now I'll let you
That's okay. I'm glad you did. So when obviously inflammation is going to cause heat, so we're looking for symmetry and stability over time. So in layman's terms, if one of your breasts starts to develop a fever, it's going to let us know at a very early stage, so that we can hopefully do something about it and work with a healthcare practitioner that actually respects our values and learns about who we are and helps us be educated on what we can do to change our path and eliminate inflammation. Being it, inflammation leads to all disease basically, so we want to catch it early. And the human body is absolutely amazing. If you break a bone, it can actually heal itself. If you've been in a horrible car accident, you're just given some time and empowering tools to help your body heal. It's just absolutely amazing. So if you are just alerted to a possible fever in a specific region of your body, but we're talking about breast today, that you can actually do something about it and help your body heal, be it via vitamin D, which is so important, or lymphatic massage or drainage, depending on your specific issue. And what's really great about thermograms is they actually speak for themselves. I have been so amazed and thrilled when I see women they can see their own thermogram, and they can tell that it's like one of their breasts looks a lot different than the other, so that might be more concerning. But even if it's an overall inflamed, very prominent thermovascular pattern, they can actually work with their doctor, and I've seen results in 3 to 5 months where it's just eliminated, or even really significant fevers in a specific region be eliminated. So again, it's about having to, we have created this fear-based culture where women are just scared to death. So basically they're taught that breasts make you sexy and attractive, and we should be, that should be celebrated. To when you get to about your 40s, now they're these time bombs that are going to go off and potentially kill you. So I think we need to change that paradigm. We need to focus more on empowering women and not let another generation live in fear, and utilize physiological tests first. But just as important, utilizing some of the money that is raised for research to find a cure that, by the way, we're no closer to finding yet. And that's why I felt when my mother got cancer, I'm like, how many years have to pass before we realize it's like we're not, the definition of insanity is doing the same thing over and over, expecting different results. So you really need to, in my opinion, there's ways to head things off at the pass and not just create this fear-based culture. And in fact, fear can, cause disease as well. So for me, I personally have not had a mammogram because of the points that you had raised. Ionizing radiation can cause cancer, and when a woman is younger, they actually need more of the ionized radiation for the mammograms and more compression. So again, that just instinct, you have to kind of follow your instinct at a certain point too, and common sense. And it's like, does that really make
what is
sense?
the state of the art with the conventional medicine at this point with respect to the expert recommendations for when women should have mammograms? Is there can you review that?
Well, there's a lot of
which task force?
There's a lot of controversy. The United States Preventive Task Force, Services Task Force concluded in 2009 that women should actually, first of all, and this gets swept under the rug a lot, they really urge women to work with their doctor, the person that knows them best, about how often they should have mammograms, and to work with a doctor that does respect that woman's values. And they recommended not having mammograms until the age of 50, and even then, how often, again, is up to you and your doctor, maybe every other year. It all depends. We're all unique, so we all have unique needs and unique risks and whatnot. And then also to stop having them after 74. You really have to start wondering what is the necessity and what path are you, really pushing these women down if they were, being, and again, repeated radiation all those years. I've imaged, a couple of women who had their annual mammogram year after year, just like they were prescribed, starting in their 40s, and who are now in their 60s. And you can easily see on their thermogram that there's a very significant issue that the mammogram has still missed. But their thermogram has led to further evaluation with MRI, and a biopsy is the only thing that can diagnose cancer. So again, people get confused. Mammograms, MRI, thermography, ultrasound, none of those modalities actually diagnoses any disease. A biopsy is the only way to actually diagnose cancer. So you can imagine how frustrated they are to have had all those negative mammograms continually, and then here's this physiological test that easily shows your breast has a severe fever. Well, what would that a fever been like maybe 10 years ago if you would have had the heads up to that?
From your perspective, are there any concerns or dangers for MRI evaluation of the breast?
I think it's cost prohibitive, but I think it causes a lot of anxiety. I think there still needs to be more research of the possible risks, or the the dangers, the risks, the benefits, and the weaknesses. I do know that they can also, because they are so sensitive, detect a lot of lumps and bumps and abnormalities that aren't cancer. So again, it can cause unnecessary biopsies and false positives. So is that a risk? I think it is. I think a lot of these women, being around the imaging industry now, knowing how fearful, like when a woman walks into a radiologist's office, she's like walking the plank. It's almost like she's holding her breath until somebody comes out and says, okay, you're clear, you're fine. I mean, what does that do to you? What does that do to you every year, just emotionally? So even an MRI, now you're getting more, false positives, or it can miss cancer too. So again, nothing is perfect, and we really need to know our bodies. That's what I believe, that, putting the money into education and away from maybe some of the pharmaceutical.
Now, one of the recommendations for the Preventive Task Force was that for women with risk factors, like yourself, who has a mother who died from breast cancer,
right,
would be in a subgroup that may benefit from mammography screening before the age of 50. But speaking as a woman who fits into that group, obviously you don't agree with that because you didn't follow that course, but do you think it's wise, or do you think there's ever any indication that mammography might be indicated as an adjunct in special subgroups, women with particularly high risk or genetic increase risk?
I can't speak for anyone else, but for me, absolutely not. That technology for me would not be an option. I'd be very concerned, when cancer starts to develop, as obviously you well know, but maybe the audience is not as familiar, is that when a healthy cell, cells divide and replace themselves. So when the healthy cell replaces itself, the body naturally eliminates it, and so the next cell goes on a healthy path. But a cancer cell, when it duplicates itself, it actually has a DNA defect, so it actually starts cloning itself over and over. So there's a very fine point of when you're under stress or you're not healthy, that it's almost like it's vulnerable when when it's starting to split, and if it was being radiated or something traumatic happens, that could actually cause that DNA defect. So with having repeated ionized radiation, maybe right during that process or in a weak area in the breast tissue, that would really concern me. And also again, the compression. So that, for me, I think it can be too much trauma. I've heard stories, women have fainted, women have been bruised for months, women have they'll get when you get hit in the arm and there's a welt that lasts for a long time, and I just heard some really sad stories, and I just think that we can get to the moon, but we can't think of a better way to help women be empowered to prevent cancer or detect it at an early stage before it becomes a very invasive surgery. Whatever you point that thermal camera at is going to read, like you said, there's no risks or harm. It actually reads the information coming from you or the chair behind you or the camera or the wall. So
as much risk as taking a regular photograph.
Exactly. So it's collecting really important data that can be analyzed and evaluated over the years. So what I'm trying to do personally is try to have thermography as universally transparent as some of the other modalities. Like if you were to have a mammogram or an ultrasound or an MRI, you could then send it to another location and it can be read. And that's where I think thermography needs to get.
It's not there yet.
It's not quite there yet. So
is it moving in that direction?
Yes, it's definitely moving in that direction because it has to in order to be. I mean, one of the reasons I believe that a lot of doctors dismiss it is because they don't know that much about it. So I've created a report that you can actually engage the actual images. So if any doctor anywhere in the world had this inexpensive software, they can engage the image themselves, to also measure the temperatures. So
there's another piece of software that you scan your thermogram into that allows you to have this interaction with it?
Exactly. It's an interactive report because I just believe it's very important to be very open and transparent so that anyone can give a second opinion and the doctors can work together and help evolve the technology instead of constantly trying to squash it. And not all doctors are. I mean, I've been utilizing it in a pretty relatively small community, and I have.
Which is where?
Up in San Luis Obispo County, and now I'm working also in the Santa Barbara County. So doctors who weren't even familiar with thermography at all, if I go into their office and I show them the case studies, the images speak for themselves. And when you can see a woman high-risk thermogram lowered, you can't argue with that. So I've not had one meeting with a doctor where they have sent me away, dismissive. They have included it. They'll refer the patients. They will utilize it in their own office. And the only resistance that I've had in that community is from the actual radiologist up in San Luis Obispo, where one of them sent me an email naming names, and they basically said, we campaigned against you, we reported you to the FDA, and you know, how dare you come into our community and offer this as an alternative? Well, in my view, it's
you're a risk to their revenue stream.
Exactly. And you know, I actually found it very amusing that somebody like little old me was such a threat to such a huge industry. It's like, you know what, the emptiest wagon sometimes is the loudest wagon. Because I'm like, what are y'all so afraid of? It's like, so prove me wrong. You know, it's like, you know, let's put them all up against each other, because to me, it's not about one versus another. It's like, how do we use them all together to help the women? So when you put a thermogram up next to an anatomical test, and you can see the heat that may be backing whatever the anatomical test is seeing or not seeing, that's much more powerful than just having a black and white picture with no temperature measurements. That's actually kind of ridiculous. It's like, I think it would just be more powerful. And most of the doctors, like I said, as soon as you explain that to them, they're like, of course, why wouldn't I want all the information? Why wouldn't women need to be empowered with all of their information and not just bits and pieces that certain groups or individuals want to, you know, delve out? I mean, there's actually been laws that are now being changed in certain states, and they're actually, you know, considering it at a federal level that makes it mandatory for radiologists to inform their women of their patients of their density. That's one sentence, and it's, why is it causing so much controversy? It's like, why wouldn't you want to let them know their density? Well, because if they knew their density, they would know that they need to have another screening besides mammography, or maybe mammography is not the best route for them.
Again, another threat to the revenue stream, which is quite significant.
Multi-billion-dollar stream.
Yeah, so there's a lot of motivation and effort to preserve that capital inflow. So there are strategies that one can implement to address a suspicious mammogram or thermogram. And I'm wondering if you could highlight from your perspective some of the more successful interventions that you've seen and been able to change. I'm particularly interested in this lymphatic massage, because that's something that really isn't written about too much or in the literature.
I have some case study images that actually speak for themselves, where a woman will have a thermogram and the mammogram would have been negative, and there's a very prominent localized thermal vascularity in one area, and this is in many patients. And so after being informed of that and being able to go back to their progressive integrative practitioner, working on getting their hormones balanced naturally, making sure they're getting enough vitamin D, and then also utilizing the lymphatic massage and just keeping yourself informed. But I've actually seen improvement just within months. So you can imagine what it's like for a woman to be like, yes, you know, all my hard work's working out, you know, and the preventative strategies and therapies that my doctor helped me, you know, be educated with, you know, here I can see it. So that then that changes their life path. That's the thing that's been so thrilling to me, is watching women lose 30 pounds and get off gluten and, you know, get rid of the sugar, because when you see images like that, it's a big wake-up call.
Yeah, so, and it's a wake-up call where there's still time to wake up.
Exactly.
It's not like you're 5 minutes before you're going to die.
You know, my biggest thing is, because I was there with my mother when she got diagnosed, and so I know what the devastation that it caused her.
And how long after she was diagnosed, did she pass away?
About 5 years.
5 years, okay.
Right, so it came back, and, you know, it was just a horrible situation, but it also devastates everybody around her, because they feel helpless, and, you know, you just, you know, wish she would have known about thermography. I mean, it's been FDA approved since 1982. So if my mother even would have known about it, I mean, here she was.
It's 30 years.
Right, she was 49 years old. I mean, to me, that's ridiculous. So,
and how typically, what's the stage at which a thermogram is able to detect cancer? You said mammogram is 8 to 10 years. What is it in the thermogram?
Well, I'm glad you asked that, because another thing that is a misconception is that thermography does not provide a negative or positive report result. So it's basically letting you know what your unique temperature data is. You know, our bodies are pretty symmetrical temperature-wise, side to side, and that data is collected and utilized and watched for stability and symmetry over time. So it's going to let you know that there's inflammation in an area that needs to be addressed. Now, when I have imaged women that are clearly a significant heat signature is indicated, and I know in my heart that's probably a pretty sad situation, it still doesn't diagnose cancer, and it also does not tell you the lump is right there. It's going to let you know that that area is inflamed and it needs further evaluation. If I personally had a thermogram, I have a spot on my breast that I've been able to watch all these years that's about 3 degrees higher than it should be compared to the other side, but it hasn't changed. So that's me. It's like I was a tomboy, maybe I got hit in my breast when I was developing. Everyone's unique. So it just gives you that power, because I know, well, that's a weak spot. Because if I get, if I
watch it more carefully.
Exactly. It just makes me more diligent. So I just think that, it just drives me crazy when people are like, well, it gave a false positive, and then other imaging was done and nothing was found. Well, maybe the tumor wasn't big enough for all those other options.
But is there a typical state in the cancer, the stage that is developed? Like, 8 to 10 years for mammograms, is it like 3 to 5 years, or where cancers are diagnosed? Are they diagnosed at a much earlier stage?
Well, I believe
you can't diagnose it because you rely, the next step is a mammogram, and you're still the same.
Right. I mean, like I had mentioned, the mammogram, MRI, ultrasound, or thermography doesn't actually diagnose cancer.
Right. So it's a biopsy that does. Right.
Right. But if you were alerted to, what basically happens is when a cancer starts to develop, in layman's terms, it tricks your body into dedicating that tumor with its own, even at the most microscopic stages, with its own unique independent blood supply. Well, what does blood do? As it pulsates through your body, it causes heat. So here you've had this pattern all these years, and all of a sudden you've got something coming out of a different area. It's an independent blood flow that wasn't there before, which could maybe diagnose it, if you want to say, at an earliest stage. Like, what is that, and why is that, and how do we reverse it? Because, as we know, our bodies are very powerful if we are alerted earlier. So I can't really give you a year, because I've seen women in their...
Oh, just what's your guess? Is it able to diagnose it half the time, or? I mean, more it's got to be before.
Oh, way before. Many years before.
Yeah. So I mean, there's a major advantage, and with the doubling time, the earlier you find this and implement your preventive strategies, because, as you mentioned, the body doesn't want to get sick. It wants to stay healthy. Its normal path that it's designed genetically and historically, ancestrally, is to move towards health. It only gets disease when it's bombarded or influenced by toxins or unhealthy lifestyle approaches.
Right.
So if we can identify the risk beforehand and take a course correction, then your body's going to get healthy, and it'll resolve the issue.
Exactly. I mean, I think the body can heal cancer itself. I mean, we definitely want to catch it with a physiological test, many years before the structural changes occur, because obviously it's a lot more challenging.
Much quicker, or sooner, actually, than a mammogram.
Yes.
And with zero risk.
Right.
Zero risk. As much risk as taking a photograph of yourself.
Exactly. Nobody touches you. It's completely harmless. So, yeah, just much more empowering. I mean, I guess my whole goal and my life mission now is to make sure that women have all of their information, all of their facts about the strengths and weaknesses of all of our options, so they can make the decision that is best for them, because I know how fear-based it is. I was there with my mother when she got diagnosed, and immediately it's like you're going across the hall, you're having this thing taken off, without, they're expecting women to make decisions when they're basically being chased by a lion. Like, you're in the most incredibly stressful situation that you've ever had in your life, most likely, because you're fighting for your life or you're fearing for your life, and now you have to make all these life-altering decisions. Well, ladies, nobody wakes up with those decisions but you. Not your doctor, not your oncologist, radiologist, surgeon. It's about taking a breath and not being forced into anything you're not comfortable with. Having a mammogram or a thermogram or anything that you're not comfortable with. And especially once it gets to a more serious situation, your hair is not on fire. So I just want to make sure that women have all of their information so they can make the most, the best decision for them personally.
I'd just like to emphasize a point too, especially since we're talking about breast cancer. You have to be living under a rock to not know about the vitamin D, so we won't go there. It's pretty well established, and even traditional physicians understand that. But what's not so well understood is that breast cancer is almost always, there's some factor of an excess estrogen component. So it has too much estrogen, not enough progesterone, that whole balance which you referred to earlier. But much of that exposure is due to what's called xenoestrogens. So this is it's wise for every woman to do this, but especially if you're at a higher risk
risk.
based on your thermographic analysis, is to avoid these. And the simple way is to eat organically, because
Exactly.
pesticides and herbicides can be potent estrogen stimulators or mimics, and as can plastics and BPA and phthalates. So these are things, and soy can do that. So you want to limit those things from your life so that you don't have this strong estrogen influence that's essentially feeding the cancer cells.
Exactly. Like you don't, like estrogen's kind of gotten a bad name because women need estrogen to stay young and healthy and keep our skin, you know,
That's a good thing, sure.
looking good. And it's about how your body is not metabolizing it correctly. And it can be now this villain that can really cause havoc. So again, you know, making sure you work with a integrative, progressive doctor to help you balance your hormones naturally and stay away from the synthetics. You know, you might need a bump, you know, a little bump here and there to get back on track, but just trying to stay in a pH balance, the whole health.
Do you have any other comments you'd like to bring, or what you've learned in your last few years in doing this?
What I've learned is that the human body and spirit is absolutely amazing. I have seen women have high risks thermograms that most likely may have been cancer, and reversing it or taking another path and getting healthy. And that's my goal, is just to get them to engage early before they do have that high risk, you know, thermogram. So again, you know, just empowering women so they feel like they have the necessary tools to stay healthy and you know, create a better life for their children. I mean, we have to change the world. So I went ahead and because of my experience, as I mentioned, when I became a thermographer, I wasn't anti anything else. I was just wanting to make sure that women had thermography available to them. But because of the stories that I've heard, I'm actually doing a documentary because I want to give those women a voice. I want to make sure that right from their own experience that other women out there can understand how thermography changed their lives, how thermography empowered them, how thermography saved their lives sometimes. So, you know, I guess that's the most important thing, is making sure that women have a voice and to share with other women that they've had those same experiences, and we don't have to keep going down that same path. And we need to take a different path so we can eliminate cancer altogether.
Well, let us know when you finish that, because it's an important message that tends to be suppressed quite effectively by these large corporate interests that have billions of dollars, or tons, or maybe even hundreds of billions of dollars to be generated through the traditional diagnostic
Absolutely.
process
It's
that's
quite
being
the
used
machine.
commercially. Yeah, and it is a machine.
Yeah, don't get gobbled up by the machine.
Or the factory farming, factory diagnosing. So.
Yes.
Well, thank you for coming, Gaea, and I appreciate all the information you're sharing with our viewers and educating us about this really important topic so that we can all take control of our health.
Thank you for having me.